Hi, I'm Stephanie Hrymak, and I'm here today interviewing Brittany. Can you tell me a little bit about your career that you are in?
Of course, Steph. I am currently an osteopath. I graduated first from kinesiology, a four-year undergrad, and then I went on to continue my education as an osteopath. It's a 3-year program, and it's a professional degree, so now I have my diploma in osteopathy manual practice. I am also the clinic manager at the private clinic that we work at in West Hamilton, so I'm managing a multidisciplinary clinic, so many different professions from athletic therapy, physiotherapy, massage, and very widespread, including sports medicine doctors and kind of how everyone works together in order to benefit the patient. That's kind of what I'm doing right now.
Oh, okay. So what made you get to where you are today?
Well, it's kind of twofold. Initially, when I was younger, I was a competitive dancer, and I injured my knee, and I had to go see a physiotherapist that got me back on the stage, which I was very thankful for. And so I was kind of had an interest ever since then. And then while I was in my undergrad, I had a mentor who was teaching me throughout my placements, and I definitely reassured me that I was on the right track. And so I just kept following in those footsteps and kept going.
What barriers did you face?
Well, I mean, you're always interested in so many different areas of the field you're going into, so it was really hard to focus in on what you were really interested in and wanted to pursue, and rather than being a jack of all trades, you want to be a master of one, right? So you had to really choose, which was definitely a tough decision.
So you had other options that you wanted to do?
Of course, there's always, like, within one field, there's many different venues you can go to, right? Whether from kinesiology, for example, you could go into medicine, or you can do your master's right away, more research, or you can do the hands-on treatments that I went for. You can also do more of an exercise-based, treatment seniors or children. So there's so many different courses you can take and specialties that you can have that it's hard to narrow it down. So I thought that was one of the biggest boundaries that you've had to face.
Would you want to do any of the other ones, or would you want to just stick with what you...
I think I've chosen the one I like. Yeah, so I work with a lot of sports teams and athletics, which I do enjoy very much because they're very motivated to get better, which is very key in the rehab process. And I do get to treat clinically as well as on field, so I think I have the best of both worlds, being able to switch it up and not get bored. If I did have to choose one more thing that I would do after this, I am going to do my master's in something. So whether it's a physiotherapist or just in rehab sciences, in order to further my studies and be able to teach. So I do want to teach at a university, college level at some point, and hopefully small class sizes so you can get the most out of the learning experience. But that's definitely where I want to go from here as well.
Oh, cool. So how did you overcome your barriers?
Well, I'm very thankful that the kinesiology program is kind of developed that way, that the first couple of years are very broad and you get to kind of dip your hand in every different thing in order to see what you actually like or feel comfortable with. So aside from just the schooling aspect, I did try to volunteer in several different places, and you can usually tell within the first couple of days whether you're actually going to enjoy it and want to do it for the rest of your life, or you maybe made the wrong choice. So I did go through a bunch of that, and eventually with the sports teams and the hands-on treatments in a clinic, I felt like that was the best choice.
So what's the best advice you would give someone who wants to be in your field today?
Well, honestly, they're probably not going to want to hear this, but to volunteer as much as you can while you have the opportunity to. While you're a student, it's looked highly upon when you volunteer in places, and you get the most learning out of the actual experience, right? Not the books you're reading in class, but actually performing what you're learning and doing it. So aside from that, another big thing to remember is to always have confidence in what you're doing, but always remember that there's still lots to learn. Whether you're a student or a professional, you're still going to continue your education, take courses on weekends. There's always so much out there that you're never really done learning.
Okay, so going off of that, you mentioned volunteering. So what would some places that you recommend volunteering at to get to where you want to be?
Okay, well, for example, the ones that I found most benefited me was at McMaster. They had volunteering in the sports medicine clinic, so actually working with patients with modalities, exercises, a bit of soft tissue work if allowed. And they also had placements with sports teams, so I got to work with the McMaster football team while I was still a student, which was a great experience and definitely what benefited me the most. There are also many different places like seniors' homes, cardiac rehab centers, spinal rehab, stroke centers in the hospitals. There's just so many, right? That you kind of have to go with what you're interested in.
Okay. So what did you do with the sports teams? Like, did you help?
Yeah, so there was a supervising athletic therapist there, so she kind of trained us for weeks before season started, and then she oversaw everything throughout. And so we, specifically with the football team, because that's what I worked with, we did all of the, pre-practice, pre-game taping and all of the stretching, warming up, getting them ready, and then monitoring them during practice, right? Watching mechanics and watching plays, making sure that, you're not going to miss an injury just from not watching. And then you could do a bit of an assessment overseen by the therapist, and then some treatments as well, guided, of course, but you got to kind of take part in every different aspect of them. So the practices, the games, beforehand, afterhand, how to deal with things long term. It was kind of all encompassing.
Oh, okay. If there was one thing that you would change today, what would it be?
That's kind of a tough one. I mean, I am very happy where I am today at this point in my life and my career. But I guess upon graduation from school, I helped the owner set up the clinic that I'm currently working at. And so I've kind of been there since graduation up until today, which I guess is a pro and a con. So I've, built up through the practice to become the manager, which is great, and I know the ins and outs of it, which is a plus, but just to have some different experience maybe under my belt would be the only thing that I might regret.
So when you first started at the clinic that you work at, how did your roles change throughout the time that you were there?
Well, initially, I was hired as a kinesiologist, and it was a very small clinic initially, so I was the administrator as well, so I kind of took care of all the bookwork and all the boring stuff. So from that time, we've hired, more therapists along the way, and so we started out with just 2 of us, and now there's 12 plus, I believe. So throughout the years, I was going to school, so now my role has changed to be an osteopath at the clinic, and only a very part-time kinesiologist, helping some days that are really busy. And obviously the other side of it, the administrator side, changed from that to manager, and now we've hired someone else for that role, so a bit of small changes.
So if a client was to call your clinic, what types of things do you offer? Or do you just offer one thing?
Many things. So there's, if you want me to list them off.
Sure.
So there's physiotherapy, athletic therapy, massage therapy, osteopathy. We provide acupuncture, custom orthotics, bracing, whether it's custom or off the shelf. We have a medical doctor, so you can see the doctor for x-rays, MRIs, injections, those kind of things, dealing with sports related or musculoskeletal issues. And then we also have a naturopath that kind of deals with the same things but on a more holistic naturopathic level. I think that's it.
So what would your demographics be overall in the clinic?
So very active-based population. So most of our referrals come from either the field coverage that we deal with, so sports teams and stuff like that, or from the gym that's in the same plaza as us. So we have a great referral source from them. So anybody who's, in the gym and they're like, oh, my shoulder's bothering me, what can I do? So the trainers know right away to pick up on, things like that and say, yeah, there's this great place right next door. And so we deal with a lot of active, motivated clients.
Okay. Well, thank you for taking the time to do this interview with me. I learned a lot.
Well, thank you, Steph.